Welcome on the News Belt on the AM show. And in our first story, Chairman of Ghana's Hajj Board, Ben Abdallah Banda, says the board has commenced preparations towards improving the 2024 Hajj exercise. He is optimistic the early arrangement will deal with a number of hiccups encountered in this year's Hajj organization. His comments follow the safe return of the final batch of Ghanaian pilgrims who traveled to Saudi Arabia to partake in this year's Hajj. Anasabit has more.
Hajj pilgrims filled with both tears and smiles left Mecca for their respective homes after completing the final ritual of the Hajj pilgrimage, leaving behind cherished memories and strengthened faith. Here in Ghana at the Hajj village, these people eager to see the return of their families who were on board the last batch of the over 4,000 pilgrims who traveled to Saudi Arabia for Hajj waited patiently for their arrival. It's 11 p.m. and at last, these pilgrims touched down at the Kotoka International Airport. The visibly exhausted pilgrims were welcomed by members of the Hajj Board and some cheerful family and friends back to the Hajj village, where they wait to finalize their travel plans back to their respective homes. Chairman of the Ghana Hajj Board, Ben Abdallah Banda, thanked the government and stakeholders for their unflinching support in making this year's Hajj a success.
Today, the final flight that airlifted the final batch of our pilgrims has just landed. Myself and Aziz Futa and our third national vice chairperson, Alaji Masaoud, who are members of the Ghana Hajj Board, and some other members here present were here to receive our pilgrims. It's a learning curve for all of us. So let me seize this opportunity to thank the President, His Excellency Nana Addo Akufo-Addo, for first of all reposing this confidence in us. And of course, the Vice President has also been very instrumental in this whole Hajj affair by giving us from time to time pieces of advice.
He adds that the preparations towards a smooth 2024 Hajj pilgrimage is already underway as the board seeks to commence its activities early in order to have a smooth Hajj and return on an early date.
Next year is just at the corner. Inshallah, all things being equal, next year's Hajj will begin in September. So we are in July. Next month is August. In September, they are going to start the preparatory grounds for the taking off of next year's Hajj. So we are also going to ready ourselves, get ourselves, and do the necessary meetings and make sure that we leave early, get to Medina early, and finish our program in Makkah early, and also leave Makkah early.
Alaji Masaoud Osman is a member of the Hajj Board. He's optimistic that the board would institute measures from the experience they garnered this year to help improve the 2024 Hajj pilgrimage.
We take that experience. After seeing where we sleep, we tour all Mina and see other countries where they sleep. We have seen better place of some countries where they sleep, so we interact with them and see how do they come by getting this better place. So we had much experience, thinking that by next year, inshallah, we will give our pilgrims the best reception, the best of feeding, and the best of transportation, maybe from Mecca to Medina.
Some of the agents who facilitated the processes of the Hajj pilgrimage commended the overall organizers of the exercise and expressed their joy for the successful airlifting of pilgrims back home.
I want to commend all the Hajj Board chairmen that I've worked with, Alhaji Ben Abdullah and Executive Secretary Farouk. I want to commend them for their good work done, and I want to commend, the Hajj committee for this year, and we expect them to do even much better than this year.
Gaskiya banan ga haji ya bambanta da haji duk hajin da ake yi domin akwai jama'a na kikoso. So godiya ta musamman zai je wurin board farko, so mun ji dadi kwarai za mu gaisuwan mu da su.
Sheikh Isa Abdullah is a member of the Ulama committee that provided guidance to the pilgrims throughout their Hajj journey. He admonishes them to strive towards leading a much pious life to show that their journey to Mecca has impacted them positively.
This is a humble message to my dear pilgrims, Alhajis and the Hajjis, that in the first place, we must fear Almighty Allah. We must fear Almighty Allah. Number two, we must show that we have changed to the positive aspect. People should see the change in us. That, oh, this person has gone to Hajj and we have seen positive change in him.
Hajia Musliya Muhammad on her part cautions would-be pilgrims to desist from embarking on the Hajj pilgrimage by dealing with unapproved agents who leave them stranded in Saudi Arabia. Hajj, the fifth pillar of Islam, enjoins every Muslim who can afford and is physically fit to embark on the pilgrimage at least once in their lifetime. Anas Sabit, Joy News, Accra.
In our next story, the Bono East Director of the National Health Insurance Authority, George Opondankwa, says the region has witnessed an increase in its active membership. He believes the authority's digitization drive is a positive step towards helping the country achieve universal health coverage by 2030. He made this disclosure during the mid-year review meeting of the NHIA held in Techiman. And Asabit once more reports.
Following a move to digitize the registration process of the National Health Insurance Scheme, the Bono East region has witnessed an increase in its active membership over the past couple of years. This was revealed during the mid-year review meeting of the authority held in the Techiman municipality. Regional Director of the NHIA, George Opondankwa, who disclosed this to Joy News, noted that the development is a positive step towards helping achieve a universal health coverage by the year 2030.
For Bono East, anything health insurance, we attach serious attention to it. So from even what you witnessed this morning, mobile renewal, we have about 70.9% as our achievement for the mid-year. And individually, Techiman even had about 89 points, almost 90% per their performance for the mid-year. So we have made serious announcements on mobile renewal. And as I told you, our people have understood the mobile renewal concept and they are using it. And that's why Techiman office in particular, every year they keep on either first or second nationwide. And Bono is 2 years now, we have been also doing excellently well in terms of mobile renewal. So in terms of mobile renewal, we have well-educated our people, and they are using it.
He was, however, quick to note that with the establishment of a new regional office complex, coupled the provision of vehicles to facilitate the movement of its staff, the region is working towards ensuring that it achieves its targets by the end of the year.
By the grace of God and the government and our management, they have promised us with very nice edifice, our regional office. Now we are not patching with the Techiman Municipal Office again. We have our own very beautiful office complex. And also we have vehicles to support our operations. All the material that we need to support our operations, head office, they have given to us. We have computers, we have ID cards, we have all the BMS materials to support our work. And as you are all aware, we have resolved that by the close of the year, we will achieve our targets.
George Opondankwa, however, disclosed that the authority is working towards ensuring that the issue of co-payment and the illegal extortion of monies by some service providers are curtailed.
We will applaud our chief executive he has established what we call a co-payment committee. We have the National Co-Payment Committee, we have the regional ones, and we have the district ones, which are also doing their best to resolve all these issues. And recently, we released some money to pay our facilities up to January 2023. And tariffs too have been increased. So authority is doing everything possible to curb this challenge of co-payments.
The region is currently 11th on the National Active Performance Chart after securing 70.3% of its target for the second quarter of the year. Anna Sabit, Joy News, Techiman.
A study by the Hepatitis Foundation of Ghana has shown that there are more people living with the condition in northern Ghana. Director of the foundation, Theobald Owusu-Ansah, wants persons diagnosed with the disease to avail themselves of proper medical care. He made this known during a screening exercise in Tamale organized in partnership with the Ghana Health Service to sensitize the populace and encourage them to adopt healthy lifestyles.
For the last decade, Ghana has seen a rise in cases of the deadly hepatitis B and C viruses, with experts calling for a national policy to help address the threat it poses to people. Globally, about 2 billion people are estimated to have been exposed to hepatitis B virus in particular, with almost 1/4 of them having a chronic infection. Here in the Techiman municipality, health authorities at the Holy Family Hospital are engaging the services of special doctors to help educate the masses as well as offer specialist services to hepatitis B and C patients. Dr. Kofi Amoakun Obin Frimpong is a medical officer with the Department of Internal Medicine at the Holy Family Hospital. He says the high prevalence of hepatitis B in the area is worrying.
In our research, we saw that although it is spread across the various regions of Ghana, it is centered here. This is where hepatitis B is prevalent. And indeed, whenever we go for our mortality meetings at the end of the month, every time, we find out that people die from chronic liver disease, and most of them are from hepatitis B. And so we saw the need to actually conduct this screen to actually get the number of people who are positive here in Techiman, so that those who are negative, we know that hepatitis B is a potentially preventable disease. It's a vaccine preventable disease. We don't see why people should be dying from hepatitis B when there is a vaccine to prevent it, in the first place.
The facility, as part of activities to mark the World Hepatitis Day, held a free screening exercise to help provide early care to patients diagnosed of the disease.
So like I said, we want to screen the people. Those who are negative, want to vaccinate them. And then those who are positive, after being positive, we'll conduct some other tests to see whether you need the drugs, or we may have to monitor you to the point you might need a drug.
Dr. Kofi Amoakun noted that the facility is intensifying its sensitization drive to help create more awareness across the area.
Indeed, this week has been a very busy week for the Department of Internal Medicine. We have gone to vantage points to inform them about hepatitis B. We've used other avenues like the radio station. We're at Gaskia FM. Another team was at Classic FM. We spoke in Chi, discussed the menace that hepatitis B can bring to the public if they are not screened and if they are not managed.
He was, however, quick to emphasize on the relevance of screening, adding that the safest way to stay away from being infected is through screening and getting vaccinated.
The primary preventive method is to screen. Screen yourself. If you are negative, we give you the vaccine, and you are supposed to take the vaccine for 3 times.
Some members of the public who are taking advantage of the screening exercise share with us what prompted them to participate in the exercise.
For me, I think it's important because, as I said in the beginning, for the screening, it helps to know your conditions with you. If you have a problem or everything is well to your system, you may not show any sign of the conditions, but you need to know that there are some conditions with you. So that if there are some hidden conditions in your body, the intervention can be taken as early as possible.
chief of Takofiano and Atepemhene of the Tichman traditional area under whose jurisdiction the exercise is currently taking place, urges the public to take screening exercises seriously in order to stay safe.
Announcement biamra no mehwehwe imogem no hu se so obi a baso no ama so oni bi so a ba won fa me no de abon ho ban se onya sa ya de no bi.
The free screening exercise forms part of a series of activities organized by the Holy Family Hospital to mark the World Hepatitis Day. Anna Sabit, Joy News, Tichiman.
Thank you for staying. That's how we cap off the news this morning. But stay with us. The news review up next.